So Echo Northwest has done a lot of studies on economic impacts of different industries, and generally the story is the bigger the better. But that's not necessarily the case with the healthcare industry. It is certainly a sizable industry, 113,000 employees, more than 1 in 8 jobs related to the healthcare industry in the Portland region. But there's an awful lot of talk and need about improved healthcare productivity. What are we getting with all of those jobs in terms of healthcare outcomes? And that's every bit as important as the jobs and the income in the industry itself. So in many of the value of jobs reports, we're looking at Portland in relationship to other cities. And sometimes we don't find what we want to find in those measures. But in this particular study, with respect to healthcare productivity, we found Portland consistently beating other metro areas.
Not only is ours an economically vibrant healthcare sector in this area, but it's a pretty high quality healthcare sector as well. If you compare the healthcare outcomes that are generated by our healthcare companies and you compare them to major metropolitan areas throughout the nation, we rank actually very high. We rank high in terms of the outcomes that we're helping to bring about, but also the efficiency. It's generally a pretty wise use of resources relative to what's happening in other metropolitan areas.
Portland really has a world-class healthcare system across the board. It stands in stark contrast to, say, a state like Florida, where the quality is very uneven if you look at quality data from hospital systems or other healthcare providers, and if you look at the general health of their population, stark contrast. You're lucky if you live in this community because chances are you're going to get great health care. You tend to be healthier than if you lived in other parts of the country.
I think one of the things, as a health plan, we have a vast amount of data in terms of the data warehouse. Demographic information, we have claims information, experience. But I believe what I see is the future is where health plans along with the health system are taking more of a partnered approach in the care delivery.
Our research programs are broad, but they're all patient-focused. Everything that's done is designed to try to change patient care, and that includes technology, but also other interventions. Healthcare research can transform patient care in a number of ways. One is in introducing new technologies that reduce complications, improve outcomes. New technologies can also get patients out of the hospital quicker and also back to work faster and back to their families and loved ones.